Armin Budish, Health Commissioner Terry Allen, and Medical Director Dr. Heidi Gullett. We will have time for questions after all three have finished their remarks. So thank you again for joining us, and we will start things off with Executive Budish.
Thank you, Dale. Good afternoon. Thanks to the media for your time and your attention. And thank you as well to the County Board of Health. Commissioner Terry Allen and Dr. Heidi Gullett are here with me to provide some very important updates. Now, I'm not sure if either of them have legs because all I've been seeing is half their bodies. But even with only half bodies, they each do the work of several people. Their hard and excellent work helps to keep this virus controlled and to keep us safe. Thank you. One of the best ways that we can keep each other healthy is by everyone wearing a mask. The evidence is clear. Face masks work. And remember, these are face masks. They're not chin masks. They're not mouth masks. Please wear them correctly. Now I can take this off because there's nobody within 6 feet. Okay, so you want to stay safe. Before you go to a restaurant or a grocery store or some other business, you want to know if the employees are wearing masks, if the customers are required to wear masks, and if they enforce social distancing. Now, you can get that information by going to our interactive mask map at cuyahogacounty.us/masks. In the last 2 weeks, more than 28,000 people have visited the mask map. When you go to that page, you can click on a location and see all the reports, almost 1,600 already. These are reports that your fellow county residents have made regarding whether a specific business is following safety protocols or not. It's like a Yelp or a Rotten Tomatoes for COVID. And you can submit a report on an easy-to-use form stating whether a business is following the rules. The information you provide will go onto the map, so others will benefit. If the report is that a business is not following the rules, we also send the business and their city a letter informing them of the complaint. So far, we've sent out more than 2,000 letters. I encourage everyone to visit the map. Check to see what's going on at a specific establishment and to file reports, both good and bad. Next, I want to switch gears to talk about one way that we're attacking structural racism. As I think you know, one of our top priorities is to do all that we can to eliminate structural racism, which impacts everything: healthcare, education, employment, food, economic development, poverty, housing, transportation. It affects everything. One of the biggest obstacles for minorities to become successful is the access to capital to fund a business. At the county, we've been working for years to address this problem. Our partnership with the Economic Community Development Institute, ECDI, for example, has provided hundreds of microloans to small businesses, the majority of which are owned by minorities or women. And our work on opportunity zones, which are areas that have been designated by the federal government for special tax rates on investments, is informed by making sure proposed projects are building up minority neighborhoods and providing good jobs. In our work with Jumpstart, we help fund the Focus Fund, which provides loans to minority-owned businesses. And we've also worked with the Urban League to provide funding through their Capital Access Fund for minority-owned businesses. The first round of capital access funding, supported by a loan loss reserve guarantee from the City of Cleveland and from Cuyahoga County, leveraged more than $4 million to 27 small businesses, with 15 in the City of Cleveland and 12 in the suburbs. These loans created or retained 400 jobs. This first round of loans had very few defaults against our loan loss reserve, which demonstrates the success of this approach and that the companies are thriving and getting much needed capital. Today, I'd like to announce an additional loan loss guarantee to the Urban League of Greater Cleveland through its financial arm, UBiz Venture Capital. That's designed to leverage another $1 million capital injection from Jumpstart. This fresh injection of capital will support ongoing capital access fund lending to small minority-owned businesses that typically are shut out based on traditional underwriting criteria. This program continues and extends our ongoing commitment to support small businesses, especially minority-owned businesses, before and during the COVID-19 pandemic. This is an example of how we're fighting structural racism. Finally, switch one more time. I'd like to talk about the upcoming elections. And yes, they are on, despite some individuals stating that the elections will be delayed. That is not going to happen. But these elections are definitely going to be different due to our pandemic, and we all need to be prepared. First, get registered. And even if you are registered, check your registration. If you've moved or haven't voted in a while, you may need to update your records. You should go to the Board of Elections website at boe.cuyahogacounty.us and click on the voter registration link on the left-hand side of that page and make sure everything is correct and updated. Second, apply for an absentee ballot so you can vote from home. You can apply now. Voting from home is the safest and most convenient way that you can vote this year. I know there's great satisfaction for people going to the polls and casting your vote in person. But if we can all vote from home, we'll keep each other safer during the pandemic. And let me be clear, there is no evidence in Ohio that there's ever been widespread voter fraud by mail voting. No evidence of fraud. That said, of course, polls will be open, and the Board of Elections tells me that we'll be suffering from a serious shortage of poll workers this November. Poll workers are often older people who are most at risk for COVID. And if there are not sufficient poll workers, polling places may be consolidated and closed. That'll lead to long lines at those that remain open, and that's bad for voting. That's bad for all of us, no matter what our party affiliation. That's why I'm putting legislation before council next week that allows county employees to work the polls, get paid for working the polls, and get paid for their usual 8 hours of work. I know the Cavs have declared Election Day a company holiday so that their employees can also man the polls. In fact, I want to urge every leader of an organization here in Cuyahoga County, whether large or small, to support the urgent need for poll workers. Please let your employees take the time to work the polls. We need this election to go smoothly. Thank you.
Thank you, Armin. And thank you, as always, for your kind words for our folks at the Board of Health. We've been glad to be working very closely with you, with County Council and all of our community partners since the outset of this pandemic in early March. And we continue to work hard here in our response for the community. So today I'll provide an overview of several new state and local developments. And then our medical director, Dr. Heidi Gullett, will discuss some hospital trends and testing data, a bit of data in our epidemiologic brief that we post every week. It'll be on our website for you to take a look at for this week. So this week we saw that the widespread community transmission of COVID-19 continues in Cuyahoga County and certainly across the state. We're seeing some of the highest numbers statewide of COVID reports in Ohio. We remain in the risk level red category under Governor DeWine's new COVID risk rating system. And of course, risk level 4 is the highest, one level above us, that is purple. And so we're still in a very critical place in terms of our overall trending here in Cuyahoga County. We continue to work with our partners to closely monitor the hospital inpatient and outpatient trends, as well as the positivity rates that you'll hear more about from Dr. Gullett. That is the positivity rates of tests for COVID, which have been elevated over the last month here in Cuyahoga County. Per the information provided by the Ohio Department of Health, Cuyahoga County residents have been seeking hospital care for COVID-related concerns at high levels with more residents being hospitalized over the past several weeks. To date, over 8,000 COVID-19 cases have been reported in our jurisdiction alone, with over 9,500 additional close contacts being tracked. Over the month of July, we averaged in our jurisdiction 120 cases of COVID per day, with over 1,600 in just the last couple weeks. This week, while we've seen a decline in new cases, we continue to average at least 100 cases per day in just our jurisdiction. Countywide, the number has been about 2,100 cases over the last couple weeks, which is almost 20% of our total case reports since the beginning of the pandemic. We are amidst and have been in a surge for some time. 80% of the cases we're seeing, over 80%, were in non-congregate settings out in the community. We're experiencing a range of clusters in places like childcare, long-term care facilities, backyard and house parties, sporting events, weddings, funerals that involve family, friends, and other members of the general public being exposed. We've received multiple reports of cases, particularly among young people who have visited multiple bars and restaurants in the community, case reports of younger people who are COVID positive, and the number of young people aged 20 to 30 continues to climb in our community that are COVID positive. This again is a statewide phenomenon, and we're hearing about these concerns statewide. Just yesterday, we saw that Governor DeWine ordered the sale of alcohol for all establishments to stop at 10 p.m. to further reduce the risk of COVID transmission, and concerns about social distancing diminishing as the evening progresses in those environments. So let's talk a bit about our K-12 schools, which have been actively developing implementation plans for this coming year. So at CCBH, we've been working closely with our school districts and the educational service centers of Northeast Ohio, who's been a great facilitator in the process as we work through all these critical discussions. In fact, we continue to meet weekly, and most recently, we met with our superintendents this morning. During our conversations about COVID-19 activity in the county, many of which I described to you, there's a range of critical factors that we've looked at and repeatedly analyzed and considered as we've gone forward. We look at the average number of daily cases, which more than tripled, and we looked at between mid-June and mid-July, more than tripled. One big concern, and Dr. Gullett can elaborate on this, is that we do not have community capacity to test children. It's currently very limited, and we're in a large county, which is very concerning. We use testing data to understand and pinpoint where outbreaks are happening. In the absence of good testing data, we're going to have to work on symptom-based decision-making, which is how we all began this pandemic, so that's very concerning. A range of hospital data, including the outpatient data, as I mentioned, hospitalizations, ICU bed occupancy, and ventilator use continue to be monitored as well in these decision-making processes. Tracking the percentage of recent cases that have occurred in non-congregate settings, as I mentioned, is another, and we're seeing quite a bit of that, over 80% in that particular setting. And we look at the total case numbers and trends as we're currently ranked in the high incidence category by CDC for our case trends. We also, of course, look at the tracking the Cuyahoga County data reported by the Ohio Department of Health and the Ohio Public Health Advisory System. And all Ohioans can go to that report and click on Cuyahoga County or any county and see their trends over the previous weeks. We'll continue to monitor the trends and the positivity rates among those tested for COVID, which were climbing over the last month. To date, we've investigated these multiple reports of clusters, and we'll continue to look at clusters related to sports and other return to play activities. Along with maintaining a safe learning environment for students and staff, a number of questions have arisen related to preparation of sports competitions this fall. These and other extracurricular activities may not be conducive to the use of key protective measures like social distancing and the use of facial coverings during participation. So consequently, concerns about the potential for COVID transmission between athletes, trainers, coaching staff dramatically increase with those concerns. Transmission that may occur in these settings then has the potential to spread elsewhere in the general community. We're aware that nationally, COVID testing positivity rates are being closely monitored at the federal level, as there are concerns about major surge in the southern states moving up into northern states like Ohio and into the Midwest. Data on the spread of COVID among kids continues to expand as more countries conduct scientific studies on the risk of transmission. A new well-designed study of 65,000 people in South Korea that recently came out indicates that children aged 10 to 19 can spread COVID just as well as adults can. So we're concerned and continue to monitor the data that is newly available in what is a brand new disease, and we continue to watch the data to learn more and more about it. Our data here in our county clearly indicate that the current level of community transmission for COVID is significant. Consequently, we need to limit our activities and do all we can to prevent spread by wearing facial coverings, maintaining social distancing, increasing hand washing and high-touch surface cleaning, staying home when you're ill, and following the state public health orders. It's important for people to remember that they may go to work and have their mask on, or go to stores and wear their mask and social distance. But when they come home to their family, those rules don't change in terms of distance and risks and mask use. Those exposures can happen in the home, which is very often where we see most of our cases reported, secondary cases. That is, if we have a case of COVID, often the initial cases are other family members. And then, of course, they go about their business and then have the potential to spread, sometimes unknowingly, in the community before they exhibit symptoms. This is how this pandemic has spread so widely here in the United States and around the world. The actions of individual students, staff, and their families, coupled with the ability of schools to provide safe learning environments using protective strategies, will have a major impact on the viability and safety of extracurricular activities, including athletics. So we've had to think this through and had to make some very, very difficult decisions here recently in collaboration with other public health partners and looking at the data to help us make decisions. With these critical factors in mind, we'd offer the two recommendations that we've shared, that have been shared in the media certainly, and we've shared with school districts. We recommend that the schools begin the 2021 school year operating remotely due to the elevated health risk posed to students, staff, and family members. We also believe that schools should discontinue extracurriculars such as sports, band, theater, and choir, and other activities during the remote learning period. We understand that these recommendations, particularly related to the impact on under-resourced school districts that serve low-income communities of color. We're equally concerned about the risk of COVID transmission in these same school districts, as our data indicate that African Americans are 3 times more likely to contract COVID than their white counterparts. Weighing all these challenges, we believe this approach will allow both school administrators and public health officials to continue to assess the risk level of community disease transmission on a weekly basis, and assess in continue to assess, and these data will assist us in creating the safest possible environments for students, staff, and their families. Any changes to this approach will be determined by evaluating data from a range of the indicators I've mentioned, including the positivity rates, the Ohio Public Health Advisory System, relevant hospital indicators, and tracking the new incidence of cases. We're aware that our peers in Columbus and Franklin County, as well as Dayton, Montgomery County, have made similar protective recommendations. A number of the largest public school districts, in Ohio have also made the decision to delay the start of their school year. We'll continue to cautiously watch our case report numbers, testing positivity rates, and other key factors in the coming weeks. It's important to recognize that when schools reconvene with in-person classroom or extracurricular activities, we anticipate outbreaks of COVID. The goal is to do all we can to reduce risk. It makes good sense to assure that we're flattening the curve, again, so that schools can institute their plans safely. These are recommendations, and we understand that school districts may need to make decisions that are appropriate for their individual school communities. These are very difficult decisions, as we are living in unprecedented times, and there are clearly no easy answers to be found. We just want to make sure that people understand that we thought hard about this, talked to our partners across the state, in the community, looked at the data, and believe that this is the most protective public health approach that we should take for our community and for our families. We receive many inquiries from the public and refer people to our COVID school guidance page on our website at www.ccbh.net/coronavirus for more information. So I want to talk a little bit about flu and other vaccinations before I turn it over to Dr. Gullett. Please remember that influenza season is just around the corner, and our continued vigilance is essential. We've been talking about this since the onset of the pandemic and concerns about what the fall may bring. We're still very concerned. We're concerned about influenza and COVID circulating at the same time in the fall, along with other seasonal viruses. Flu is currently circulating in the southern hemisphere in places like Australia, and they're currently reporting good news there as flu cases are below average to date this year. The positive trend's been associated with the increased use of masks in the southern hemisphere during flu season, which protects against flu and COVID since they're both spread by respiratory droplets. This new information adds to the already existing evidence to support the preventive value of masks in our community and across Ohio. This year, the CDC reports that there'll be about 180 million doses of flu vaccine available, and we have the potential to set new records for flu vaccination in the US. If you get the flu, your immune system may be more at risk for exposure to other viruses like COVID. So vaccination against flu is a sound public health prevention decision. In addition to flu, families also need to get kids caught up on any routine vaccinations during these back to school discussions to protect our children. They may include chickenpox or diphtheria, tetanus and pertussis, or DTaP vaccine, or measles, mumps, rubella, or MMR vaccine as they're called, and perhaps polio in addition to flu. This is particularly important in low income communities of color where we know rates are lower and there are gaps in access. Talk to your children's pediatrician about your child's vaccination needs. We'll talk more about these and other issues in the coming weeks. And as I turn it over to Dr. Gullett, I want to lastly, again, thank all of our staff, including those in the call center, answering hundreds of resident calls per day since the beginning of the pandemic. The case investigators and contact tracers who work hard to control the potential for increased disease transmission, our communications and emergency operations teams that provide key messaging to the public, our staff that work every day to continue key public health programming during the COVID response, and last and most important, all of our support staff. They're the oil that keep the engine running smoothly every day. All their commitment, their collective commitment to public health is inspiring for me personally, and I want to thank all of them, everyone, all of you for your extraordinary service. So with that, I'd like to hand things back to Dr. Gullett for her report.
Thank you very much, Terry. I'm going to spend a few minutes walking through our data and then talking a little bit about the hospital utilization numbers for this week. Jonathan, I'm ready for the brief. So this week we had 717 new cases. That is fewer than the 855 we had last week, as well as the prior week, which was our all-time high since March at 919 new cases. And while this is encouraging that we had fewer new cases this week, the month of July has brought every single week with substantial increases in the number of cases over where we had been every week between March and June. Our July numbers far exceed anything we could have ever thought would happen in March through June. So while this is improving, I want folks to have cautious optimism about where we are. This is still a very high number of cases. And what that really means is that there's a significant amount of spread called community transmission, meaning a lot of COVID is spreading in people outside the hospital, person to person. You heard Terry talk a lot about the kind of encounters that people describe to us when they're positive. And it's really important to understand that the transmission is happening in settings all over our community and in surrounding communities outside of Cuyahoga County, but people often live and work here and move between lines. So this is not about just one geography, which is something we want people to keep in mind when they think about how interdependent we all are in these local Northeast Ohio communities. We move freely between communities, which means COVID transmission is also happening in those ways, especially when we don't follow the guidance like wearing masks and social distancing. If you look also on our epi brief here, you can see we had fewer number of deaths this week at 7, but I would also, again, remind you that fatalities or deaths do lag behind. Typically, we will find deaths from 2 to 4, sometimes 6 weeks later when they're reported to us. And so when we talk about loss of life with regard to COVID, oftentimes what we present to you week to week may reflect what happened in the prior month or month and a half. If you go down a little bit lower, we can talk a little bit about case demographics. We still see 38% of the cases since March through now in the ages between 20 and 39. You see it 22% between 20 and 29, with that additional 16 going up to 39. The reason I highlight that again this week is that we really want everyone to be vigilant. I know that even folks who may get this and they're younger and don't have any medical problems will probably fare well given the numbers we've seen nationally. But our concern is your ability to spread this to those who you love and who are around you and who are particularly susceptible or at risk for complications. You'll also see here that we continue to have a significant number of infections in our community of color. You'll remember that just about 30% of the population in Cuyahoga County outside the city of Cleveland identify as Black, but we still have a significant number of cases in that particular population. It's also of note that both our hospitalizations and people requiring intensive care unit support are significantly higher for people who identify as Black or African American, and that has been the case for many months. So we're increasingly concerned, and we want to use equity as an approach here, meaning everyone has an opportunity to reach their full health potential, and that's pre-COVID, during COVID, post-COVID. We've got to pay attention to the communities most affected, particularly those who have the highest risk of complications and of dying from this. You'll also note that on the far right, 18% of our cases thus far are healthcare workers, and that is all encompassing people who work in healthcare organizations in an ambulatory setting as well as in a hospital setting. And those are not just clinicians, but also anybody who works anywhere in the hospital system. That may appear to be lower than before, but remember earlier on when it was 30 and 35%, we were really only testing healthcare workers and those in the hospital. We're now testing more people in the community, therefore that number appears lower, yet we still have significant transmission happening in healthcare organizations. Every week we have new infections among healthcare workers. You'll also note that down on the bottom right corner, pre-existing conditions are 31% of our cases do not identify as having one of those, and that would be having a medical condition that puts you at high risk for complications or higher risk for dying from COVID. 38% identify as having one of those conditions. So I really wanted to highlight this today so that individuals understand that you are at risk for this infection, even if you don't have a chronic medical problem like asthma or diabetes or heart disease. We do see a significantly higher proportion of those individuals who are hospitalized and those in the intensive care unit as having those pre-existing conditions, yet we still see individuals who are hospitalized, who need intensive care support, and who have died in our community that did not have pre-existing conditions. So it's important to recognize how at risk all of us are, given our immune systems have never seen this virus before. Moving on to the next part of the brief, you'll see our traditional epi curve. And again, this week, you see the number of new cases. This is a combined probable and confirmed, but you'll also see on that first page, we give you the breakdown. So most of these cases are lab confirmed. We use the standard case definitions that are used nationally for both confirmed and probable cases. Probables mean that they are somebody who's having symptoms and has been exposed to somebody who's had a lab positive test, but they have not been able to get a test. So you'll see that we have a very traditional curve, and it is not flattened at this point. On the far right, where there appear to be some missing data, that's simply because our data for the last few days have not yet been fully sent to us. You will see those again next week. We are not at this point including the recovery because we're changing the way that we report it out, but those will be available data to you. I just wanted you to understand why today you're only seeing the actual cases on our curve. Moving below that, you'll see the map, our traditional weekly map of COVID cases. And this is the number of cases in that particular zip code, both lab confirmed and probable, since the beginning of the pandemic. This does include cases from our partners at the City of Cleveland. So the earlier data I presented to you are all of Cuyahoga County, except for the City of Cleveland, who separately report their cases. However, we partner to do this map once weekly, and you'll see their data included here. Moving on to the last part of our epi brief is the hospital utilization data. And you'll see here that things are pretty similar with regard to the adult medical bed usage. It's at 82%, which is stable from last week. You'll see that we're at 81% for ICU usage. And I just wanted to be clear that the numbers that the state uses, sometimes they use county numbers for certain metrics, and sometimes they use regional numbers. I am only presenting you all of the Cuyahoga County data. I'm not presenting the region. So this is consistent with what I have presented to you since March, so that you understand within Cuyahoga County what availability and how much use we have. This doesn't account, though, for the fact that we are within a region and within a state. We're very fortunate in this county to have a significant number of resources for medical care for those who are sickest from COVID-19. You'll see the pediatric utilization is down again a little bit. And again, the rises that we saw in the last few weeks, we do not believe reflect COVID infection from sicker kids, because even though we have had hospitalizations in youth under the age of 19, and we also have had ICU or intensive care unit admissions in children, there has not been a surge associated with those numbers. Finally, the adult ventilator usage is listed there as 37%, and you'll see it's pretty stable. We haven't approximated the 55% we had back at the beginning of April, and the number of ventilators has stayed relatively stable, which is a frequent question that we receive. Lastly, I'll go over our testing for the week. This is at the bottom of the last page of our epi brief. And we like to report out the cumulative, meaning the combined testing that occurs in the 3 hospital systems in alphabetical order: Cleveland Clinic, Metro Health, and University Hospitals. They graciously provide this cumulative data to us once a week, and our amazing data analysts put it together so that you can have yet another parameter, one that we look at when we're guiding our response to understand what the transmission is looking like in our community. You'll see for the past month, the whole month of July, the number of tests between those 3 hospital labs that were done each week. And this week, we were just over 22,000 tests. This does not reflect testing only done on Cuyahoga County residents. This reflects testing done at these 3 facilities who serve people outside of our county as well. So I want to be clear about that. You'll see our percent positive was very concerning as it began to rise in the month of July. And this week is down a little bit, yet 6.5 is still too high, and still it reflects the fact that there is spread of COVID-19 happening in our community. So of all the tests done this week, in these 3 hospital labs, 6.5% were positive, down from 7.5% the week before, and very concerning was the 9% earlier than that. So this brief is already available for you, and our weekly trend graph will also be available following the press briefing that I referenced at the beginning. In my moment of gratitude today, in addition to echoing Terry's gratitude for our incredible staff who work 7 days a week, 12+ hour days, I would also like to thank all of the school officials who have been working tirelessly to try to figure out how to best serve the children in our community all over Northeast Ohio and all over our state. The questions that they're facing, the decisions that they're making require a whole lot of thought, a lot of courage, and a lot of really thinking about different variables that matter. And we thank you for that. We thank you for your partnership. We thank you for the opportunity to help you understand where we're coming from with regard to health data. But I also want the public to understand that the recommendations we give are also recommendations for our own family, our own friends, our own loved ones. These aren't recommendations that don't apply to us. And so we here at the Board of Health really care very deeply about this community. We care about every single person in this community. And so the recommendations we give are based on science and the best data we have. But please understand that the personal challenges associated with these recommendations are difficult for all of us, ourselves included. I'm a parent of 2 children, one in elementary school, one in middle school. They attend public school. I have been personally incredibly deeply into the tension that comes between understanding what is best for the health of the public and understanding what my children need with regard to their learning and their social and emotional development. I feel that tension every single day, and so do parents all over this community. So I want you to understand that these decisions do not come easily for us, and we are in them with you as people, as parents, and as fellow citizens in Northeast Ohio. Finally, mental health and behavioral health have been a big concern for all of us since the beginning of this pandemic. This has stretched us, every single one of us, in ways we probably never dreamed we could be stretched. I know that's true for me personally. So we want the public to know, we want every single person to know that if you are struggling in any way, it is not weakness, but that we have resources available for you. If you need support, please feel free to reach out 24/7, 24 hours a day, 7 days a week to the Adams Board through our Cuyahoga County line at 216-623-6888, or feel free to text 4HOPE, 4HOPE to 741-741. These issues are really important for all of us, including our children, for whom we are making difficult school decisions. And we want you to know that mental and behavioral health are a very important part of public health and a very important part of the decisions that we are recommending here from the Board of Health. Lastly, I have seen a lot of frustration, tension, sadness, anger, challenge, many other things I could describe in the past 6 months, but especially in the past few weeks. And I would just strongly encourage us that even if you disagree with another person or with an agency or an organization, please be kind and please be respectful. We are only going to get through this together, and tearing each other down or being negative is really not helpful. We have got to love one another. Even if we disagree, we can do so respectfully. So I would again revisit something I said in the first few months at several press briefings. Please lead by kindness and gratitude, and please be respectful in your discourse. These decisions are hard for everyone. We're all stressed, but we are all in this together. And at this point, I will turn it over to Dale.
Gullett and Commissioner Allen and Executive Budish, we now have time for a few questions.
Hello, this is Bill Shield with Fox 8. Thank you for the briefing. I have a question that any of the three of you could address. As you probably saw today, the High School Athletic Association, the OHSAA, has said that it would recommend continuing with fall sports. I just wondered, based on your recommendations, is this a close call? Is that a good idea? Or does that run counter to what you think would be the health of student athletes this fall? Thank you.
So I only heard part of it as I transitioned my volume. So what I heard was there was a state recommendation to proceed with fall athletics from OHSAA. And so as we said, we've made recommendations for people to consider here for Cuyahoga County. Those recommendations, as Dr. Gullett noted, and as we've said, are based on data here in our community. And we have first are using data to be the most protective we can for our communities. Also knowing as we enter the school year, we'll be heading into the flu season. And so again, these are very difficult decisions for everyone. We've had a variety of positions taken at the state level by different associations relative to this question about sports and other academic related engagements, face-to-face or otherwise remote. So we know that people will make individual decisions based on what they believe is the right thing to do, and that's what we've done. We certainly respect that, and at this point we stand by our recommendations and understand that individual districts, state entities, will make the decisions based on, for the reasons that they feel are important as well. And, that would be my position on where the state.
Any other questions?
Emily Bamforth from Cleveland.com. I have been hearing from some districts that they feel like this recommendation might not apply as much to them because of how cases are rising in individual districts. Can you talk a little bit about just how these case numbers are varying across the county and how schools might be able to adapt this recommendation to really work for them, as well as any outcomes from the conversation with the superintendent this morning?
Sure. Thank you for your question, Emily. I'll start off and Dr. Gullett will have some thoughts as well. So when we look at that zip code map, which Jonathan showed earlier, we talked about this in previous briefings. Some of you may need to press the mute.
On the call, mute yourself if you're not speaking. Thank you.
Yeah. So as we said on previous briefings, the zip code map represents only where people live, not where they were exposed. We now have talked to over 8,000 cases and have monitored an additional 9,500 contacts that we've traced. So we talked to a lot of people. And what we know is people are getting exposed all over the place, not just in their own communities, but at bars, restaurants all over the county, traveling to places like Florida or Texas, going to funerals, going to weddings, attending parties locally within their community, in the county and beyond. And so it's important to recognize that the map is not meant to convey risk locally. The map is only presenting where people live because that's how the case reports come to us. So that's really important. The other piece we tell people is that what the CDC has told us is that the actual case numbers in our community are likely 10 times higher than what's reported, because that means that a significant folks, only 10% of us are actually being tested and have a test report indicating a positive case. The vast majority of folks are out there that may have, for one reason or another, never been tested. And so that also further complicates the data. So people should not equate the color of a map or the number of cases to risk. It is not related. And so we think looking at these countywide indicators are more appropriate. The infectious diseases like flu, like COVID, do not pay attention to the borders that we set up jurisdictionally. They move freely. As we see now, concerns, of course, with COVID now happening in the South and concerns at the federal level with the movement of the huge surge in the South heading up north to other states. So these diseases move. And so we advise that the metrics that we're looking at now, we believe that these are the best way to pursue this. And I'll turn it over to Dr.
I completely agree with everything that Terry has said. And there's rarely a district that doesn't have staff coming in from other areas, including across county lines and across municipality lines, and sometimes from far away. So just recognize that there is always spread happening, and that hyperlocal data, meaning data in a very particular narrow jurisdiction or census tract or ward, does not necessarily help us understand the actual risk of transmission, especially when we have so many healthcare workers in our community who are parents and who come home to their kids. And we know healthcare workers have been the highest proportion of essential workers infected throughout this pandemic, which continues to occur. Despite now having better PPE, we still see transmission. So I would just caution interpretation of those particular level of data.
No more questions. We will see you at next week's briefing. All right. Thank you, everyone. Have a safe weekend.
Thank you.
I'd like to say something just generally. So over the last, since the beginning of the of the pandemic response some 6 months ago. I said earlier when we talked with the superintendents that I've gotten more emails in the last 6 months than I got in the previous 31 years, I think, of work that I've done here in public service. Just the last few days, of course, I've heard from parents, I've heard from school workers, teachers, coaches, a range of people sharing their views, which have varied substantially about the recommendations that we put forward. And largely people have been very respectful in their approaches, comments, and the like. I would just echo, and I appreciate that, because we have agonized over these decisions, as we have agonized over many decisions in this last 6 months. You know, I've been born and raised in this community like all of you. And so these decisions are hard, and they affect individual families. And so ultimately we're trying to make the best decision on data, but we know it's imperfect in a very imperfect world and in a very, very difficult time. So I would just echo Dr. Gullett's comments. We'll do the best we can to put out information. If you call in and you reach our call center staff, know that they are exemplary public health servants, and they are giving everything they have back there every day to try to help you. And I ask that you respect that, because we'll do everything we can to respect your opinion and your position and do the best we can to put solid data going forward. I said to our superintendents this morning that certainly the pandemic has taken a toll on everyone. And I said, well, I'm already gray on top of my head, and I've noticed my eyebrows are turning gray. So that would be my contribution from the pandemic in the last 6 months.
I might just add one thing too. You know, we recognize how difficult this is for families when schools are not in session in person, and the kids are home, and parent has to work. You know, what do? There's not a lot of daycare opportunities out there right now because of the pandemic. So we're looking at what we can do, and we know how hard it is, and we're trying to figure out how we can best help our families here in Cuyahoga County, and we'll continue to work on that. We're just trying to do the best thing we can. The Board of Health, Terry Allen, Dr. Gullett are trying to do the best they can to keep our folks safe and balance the needs of safety against the needs of keeping our economy going and keeping families going and making sure people have the daycare they need or have the protections at home that they need. So it's complicated. We're working on it, and we recognize how difficult it is.
Thank you. Safe and have a good weekend.